Good morning, Mr. Reynolds. My name is Debbie, and I'm going to be your medical assistant this morning.
Good morning, Debbie.
How are you?
Great, thanks.
Can you just tell me your birth date?
7/15/1955.
Great. What I'd like to do now is to take your blood pressure, and we're going to do it by auscultation.
Okay.
I'm just going to clean my hands.
Okay.
It is helpful to know the patient's previous systolic blood pressure. If none is recorded, obtain one by the technique of palpation, as demonstrated in another unit. Make sure you have the appropriate size cuff. If the patient's sleeve doesn't slide easily 5 inches above the elbow, ask him to remove his shirt. Locate the center of the inner bladder. Many cuffs have arrows to help. Center the bladder over the brachial artery, 1 or 2 inches above the bend of the elbow, and wrap it firmly. Clean the earpieces of the stethoscope with an antiseptic wipe. The arm should be at the level of the heart, with the palm facing up.
I'm going to pump this up just a little bit higher than we did for your last blood
Place
pressure.
the stethoscope diaphragm over the patient's brachial artery and hold firmly so that the diaphragm lies flat against the arm. Close the screw on the valve by turning clockwise and squeeze the bulb rapidly so that the cuff inflates to a reading no more than 20 to 30 millimeters higher than the recorded or palpated systolic pressure. Loosen the valve counterclockwise and let the pressure drop 2 or 3 millimeters a second. Listen for the Korotkov sounds through the stethoscope. At the first sound, note the reading. This is the systolic pressure. When the sounds disappear, note the reading again. This is the diastolic pressure. Loosen the screw an additional turn for rapid deflation of the cuff. If you did not hear the sounds clearly, wait at least 1 or 2 minutes before performing the procedure again. This will relieve any congestion in the veins which could cause an artificially high reading.
Okay, I just want to write this down for the doctor, and then they'll be in to see you.
Great.
You have any other questions?
No, thanks very much.